Hey everyone, let's talk about something that affects millions of people yet is so often misunderstood. I'm talking about PCOS. You might have heard the term or maybe you're living with it right now. So today we're breaking it all down. What it is, why it happens, and what you can actually do about it. So first things first, what does PCOS even stand for? It's Polycystic Ovary Syndrome, and right away that name can be a little misleading, but we'll get back to that. At its core, PCOS is a hormonal disorder that messes with how the ovaries work. For many, this shows up as super irregular periods or even no periods at all, and it can make getting pregnant a real challenge. In fact, it's one of the most common, yet most underdiagnosed conditions out there, affecting roughly 1 in every 10 women of reproductive age. That's a huge number of people going years without answers. So what's going on inside the body to cause all this chaos? It really boils down to two main culprits: hormones and insulin. Let's start with the hormones. With PCOS, the body often produces an excess of androgens. You might know these as male hormones, like testosterone. Now, everyone has androgens, but in PCOS, the levels are just too high. This imbalance is what throws a wrench in the whole ovulation process, preventing the ovaries from releasing an egg regularly. It's also the reason behind some of the most visible and frustrating symptoms, like cystic acne, oily skin, unwanted hair growth on the face and body, and, in a cruel twist, thinning hair on the scalp. Now let's talk about the second major player, insulin resistance. This is a big one. Think of insulin as a key that unlocks your cells to let glucose or sugar in for energy. With insulin resistance, your cells locks are a bit rusty. They don't respond to insulin properly. So what does your body do? It panics and pumps out even more insulin to try and force the doors open. The problem is this flood of extra insulin tells the ovaries to produce, you guessed it, even more androgens. It becomes a vicious cycle that fuels weight gain, makes losing weight incredibly difficult, and worsens all the other symptoms. So if you're ticking off these boxes in your head, the irregular periods, the stubborn acne, the weight that won't budge, how do you know if it's actually PCOS? Well, doctors typically use something called the Rotterdam criteria for diagnosis. You need to have at least 2 out of these 3 things. 1. Irregular or absent ovulation, which usually means irregular periods. 2. High androgen levels, which can be confirmed with a blood test or are obvious from symptoms like excess hair. And 3. Polycystic ovaries seen on an ultrasound. And here's that curveball I mentioned earlier. Despite the name Polycystic Ovary Syndrome, you do not have to have cysts on your ovaries to be diagnosed. The term polycystic refers to the appearance of many small, undeveloped follicles on the ovaries, not necessarily large, painful cysts. It's the whole picture, the combination of symptoms and hormonal markers that defines the syndrome. Okay, so you have a diagnosis. What now? Is this just something you have to live with? Absolutely not. While there's no cure, there is so much you can do to manage it. First, lifestyle. This is foundational. Focusing on a balanced diet with whole foods, managing stress, and getting regular exercise can dramatically improve your body's insulin sensitivity. Even moderate activity can help break that insulin-androgen cycle and get your symptoms under control. It's not about extreme diets, it's about sustainable, supportive habits. Then there's medical treatment, which is tailored to your specific goals. If you're not trying to get pregnant and just want to manage symptoms, hormonal birth control is often prescribed to regulate your cycle and reduce acne and hair growth. If fertility is your goal, doctors might recommend medications that help induce ovulation. And for that underlying insulin resistance, a medication called metformin is often used to help your body use insulin more effectively. The most important takeaway here is that you are not alone and there is hope. If any of this sounds familiar, please talk to a doctor. Getting a proper diagnosis is the first step toward getting the right support and taking back control of your health. Thanks for listening. If this was helpful, share it with someone who might need to hear it. Let's keep the conversation going.